An introduction to the canine skeletal system for pet professionals. The learning objectives for this lesson are to recognise the skeletal system's role within the locomotor system, to identify the bones that make up the canine skeleton, to understand the structure and function of joints, and common conditions related to the skeletal system. The canine locomotor system is the system in a dog's body responsible for movement. It includes the structures that work together to enable walking, running, jumping, and other physical activities. The locomotor system is divided into two key components. The skeletal system is classed as the passive component. The skeletal system provides the framework and support for the body. It consists of bones, joints, and cartilage. It is considered the passive part of the locomotor system because it doesn't move on its own, but relies on muscle to create movement. The muscular system is considered the active component. The muscular system consists of muscles and tendons that attach to the bones. Muscles contract and pull on the bones, creating movement. It is considered the active part of the locomotor system. It works because the bones and joints provide structure and form the levers that the muscles act on. The muscles generate force to move the bones and joints. Tendons and ligaments help stabilize joints and transfer the force from muscles to bones. The skeletal system is the body's framework, and key functions of the skeletal system include support. Bones provide the framework for the body. Protection. Bones shield vital organs such as the rib cage, which protects the heart and lungs. Movement. The skeleton serves as an attachment point for muscles and facilitates motion when muscles contract, enabling movement. Mineral storage. Bones store calcium and phosphorus. Blood cell production. The bone marrow inside certain bones, like the femur and pelvis, produce red blood cells, white blood cells, and platelets. This is vital for carrying oxygen, fighting infections, and blood clotting. Energy storage. The yellow bone marrow found in some bones stores fat, which can be used as an energy reserve. Joint stability and shock absorption. The skeletal system includes joints that allow smooth and controlled movement. Structures like cartilage and synovial fluid within joints help reduce friction and absorb shocks during activities like running or jumping. Adaptation and growth. A dog's skeleton grows and adapts over time to accommodate changes in size, weight, and physical activity. In puppies, bones grow at the growth plates, enabling the skeleton to mature. Understanding these functions helps pet professionals care for dogs by ensuring proper nutrition, exercise, and handling to maintain skeletal health and prevent issues like fractures, arthritis, or developmental problems. Bones in the canine skeletal system are classified based on their shape and structure, as these characteristics determine their function and location in the body. The main bone classifications include long bones. These bones are longer than they are wide and have a cylindrical shaft with two ends. They provide support, facilitate movement, and act as levers for muscles. Examples include the humerus, radius, and ulnar femur. Short bones. These are cube-shaped bones nearly equal in length, width, and thickness. They provide stability and support while allowing limited movement. Examples include carpal bones and tarsal bones. Flat bones. These bones are thin, flat, and often slightly curved. They protect internal organs and provide a large surface area for muscle attachment. Examples include the scapula, pelvic bones, ribs and sternum, and cranial bones. Irregular bones. These bones have complex shapes that do not fit into the other categories. They offer protection of nervous tissue, support, and muscle attachment. Examples include vertebrae, mandible, and sacrum. Sesamoid bones. These small round bones are embedded within tendons and are usually found near joints. They reduce friction, modify pressure, and enhance the mechanical advantage of tendons during movement. Examples include the patella. Please pause the video, study this diagram, and memorize the major bones. Take a screenshot and label the major bones, then rewind and check your answers. Palpable bones are bones that can be felt through the skin because they are close to the surface of the body and not covered by thick layers of muscle or fat. In dogs, these bones are often used as landmarks for assessments, handling, or medical procedures. Examples include the mandible, ribs, sternum, vertebrae, and femur. Palpable bones are important to pet professionals for the following reasons. 1. Health assessments. Palpable bones are used to check for abnormalities such as swelling, fractures, or deformities. 2. Body condition scoring. Feeling for ribs, the spine, and pelvic bones helps evaluate whether a dog is underweight, overweight, or at a healthy weight. 3. Safe handling. Knowledge of palpable bones helps avoid undue pressure on sensitive areas. 4. Emergency care. Identifying palpable landmarks is crucial for first aid, such as checking for fractures or positioning bandages. Palpable bones act as an important guide for understanding the dog's anatomy and ensuring proper care. Joints are the connections between two or more bones in the body, allowing for movement, support, and stability. In dogs, joints play a critical role in enabling mobility and flexibility while supporting the skeletal structure. Joints can be classified based on their structure and the type of movement that they allow. A fibrous joint is called a synarthrosis and is a fixed or immovable joint. A fibrous joint connects bones by dense connective tissue and has no joint cavity. There is little to no movement, and an example is the cranial sutures, which are the joints between the cranial bones in the skull. A cartilaginous joint is called an amphiarthrosis, which you can only say in Hermione Granger's voice, and is a slightly movable joint. It connects bones by cartilage and allows slight flexibility. An example of a cartilaginous joint is the vertebral joints in the spine. Synovial joints are called diarthroses and are complex structures that make up freely movable joints. In synovial joints, bones are separated by a joint cavity filled with synovial fluid and surrounded by a joint capsule. These joints have smooth cartilage covering the bone ends and provide a wide range of movement and stability. A hinge joint is a type of synovial joint that allows movement in one plane, similar to how a door hinge works. It permits flexion, which is bending, and extension, which is straightening, but restricts movement in other directions. This design provides stability and control. Dogs have several hinge joints that are crucial for movement and weight bearing. These include the elbow joint, which connects the humerus with the radius and ulna. It allows the dog to flex and extend the forelimb. It includes the stifle joint, which is the knee, the joint between the femur and the tibia, similar to the human knee. It allows bending and straightening of the hind limb. The interphalangeal joints, which are the toes. The joints between the small bones in the toes, these allow flexion and extension of the toes, aiding in grip and movement. Hinge joints in dogs play a vital role in walking, running, and jumping, ensuring controlled movement while maintaining stability. A pivot joint is a type of synovial joint that allows rotational movement around a single axis. One bone has a rounded or peg-like end that fits into a ring or notch of another bone, enabling twisting or turning motions without flexion or extension. Dogs have one major pivot joint, the atlantoaxial joint in the neck. This joint is located between the first and second cervical vertebrae in the spine. It allows a dog to rotate its head from side to side as when looking around or shaking its head. A saddle joint is a type of synovial joint that allows movement in two directions, flexion and extension, forward and backwards, and abduction and adduction, side to side, but not full rotation. The bones in this joint have concave and convex surfaces that fit together like a rider sitting on a saddle, providing both stability and flexibility. Dogs have one primary saddle joint, which is the interphalangeal joint in the toes. While not a true saddle joint like in humans, some of the small joints in a dog's toes have a similar structure, allowing for precise movement for gripping and stability. A ball and socket joint is a type of synovial joint that allows a wide range of movement in multiple directions. It consists of a ball-shaped head of one bone fitting into a cup-like socket of another bone, enabling flexion, extension, abduction, adduction, rotation, and circumduction. This makes it the most mobile type of joint in the body. Dogs have two major ball and socket joints, the hip joint, which connects the femur to the pelvis. It allows dogs to move their hind legs forwards, backwards, sideways, and in rotation. This joint is essential for walking, running, and jumping. And you have the shoulder joint, which connects the humerus to the scapula. Unlike the human shoulder, which has a high degree of rotation, a dog's shoulder joint is more restricted to flexion and extension to support forward movement.
When a dog is walking, the hip joint is performing a combination of flexion and extension. Flexion happens when the hind leg swings forward and the hip joint flexes, decreasing the angle between the thigh and the body. Extension happens when the paw contacts the ground and the leg pushes backwards to propel the dog forwards, extending the hip joint and increasing the angle between the thigh and the body. When a male dog cocks his leg to urinate, the main movement at the hip joint is abduction, when the hind leg is lifted and moving away from the midline of the body. Adduction of the hip happens when the leg moves back towards the midline of the body.
A gliding joint, also known as a plane joint, is a type of synovial joint where two flat or slightly curved bone surfaces slide against each other. These joints are connected by strong ligaments and allow limited movement, mainly gliding or sliding motions in various directions, but they do not allow rotation. These joints play an essential role in a dog's ability to run, turn, and adjust to uneven surfaces while maintaining structural stability. Dogs have several gliding joints. An example would be the vertebral joints in the spine. These are small joints between vertebrae that allow slight gliding motions, contributing to spinal flexibility and movement. Here is a table that lists and describes the varying ranges of movements within joints. The canine skeletal system is susceptible to a variety of conditions that can affect a dog's mobility, comfort, and overall quality of life. These conditions may be developmental, degenerative, or the result of an injury or disease. Many breeds are predisposed to hereditary defects that affect the skeleton, joints, and muscles. Breeders should test for these genetic abnormalities and should avoid breeding from any dogs that are affected by the conditions or are carriers of the conditions. You can look up these conditions and the affected breeds on the Lobotlin website. There are many reasons why it's beneficial for pet professionals and dog owners to have an understanding of the canine locomotor system, including injury prevention, recognizing abnormalities, enhanced handling techniques, improved care for aging or injured dogs, better training or exercise plans, informed product recommendations, and enhanced first aid responses.